The White House is being buoyed by preliminary indications that the coronavirus curve is beginning to bend. With the decline in hospitalizations, ventilator intubations and the need for ICU beds, in addition to new models projecting a vastly lower death toll from earlier estimates of between 100 and 240,000 people, there's a view now that social distancing is beginning to show results. But with a new record of almost 2,000 dead in the last 24 hours, optimism tempered by a tragic dose of reality.
It would be nice to be able to open with a big bang and open up our country, or certainly most of our country, and I think we're going to do that soon. You look at what's happening, I would say we're ahead of schedule. Now, you hate to say it too loudly because all of a sudden things don't happen, but I think we will be sooner rather than later. But we'll be sitting down with the professionals, we'll be sitting down with many different people and making a determination, and those meetings will start taking place fairly soon.
So you wouldn't do that until the health experts tell you it's safe to do it?
Yeah, I would rely very heavily on them.
In addition, 6.6 million first-time filings for unemployment benefits have been received for the week ending April 4th, taking the total number to 16.5 million new claims in just the last 3 weeks.
I asked Congress to provide an additional $250 billion to expand the incredibly successful Paycheck Protection Program. You've seen what's gone on there. It's incredible, actually, which is allowing our small businesses to keep employees on the payroll and get ready for the opening. Like a second opening to protect millions of American jobs, I'm asking Congress to pass additional funding for this program this week as soon as possible.
We're still in the midst of it. Don't get complacent.
And despite the epicenter of New York State beginning to see a flattening of the curve, caution to citizens not to start changing their behavior, with data also showing that minority communities are the hardest hit.
Why is it that the poorest people always pay the highest price? But let's figure it out. Let's do the work. Let's do the research. Let's learn from this moment, and let's learn these lessons, and let's do it now. We're going to do more testing in minority communities, but not just testing for the virus. Let's actually get research and data that can inform us as to why are we having more people in minority communities, more people in certain neighborhoods. Why do they have higher rates of infection? I get the comorbidity. I get the underlying illness issue. But what else is at play?
2 studies of several dozen cases in New York have found that the virus began to circulate by mid-February, some weeks before the first confirmed case in the region. Contact tracing revealing limited evidence supporting the notion that it was introduced here from China, but rather via untracked transmission between Europe and the United States. Sherwin Ricepe's SABC News.